Well, Beatrice is here now with your health news, and we know that breast cancer screening saves lives, and that's why women over 50 are encouraged to have annual mammograms.
Yes, but for some women, those who have dense breast tissue, mammograms may not be the answer.
And the more dense the tissue, the more difficult it is to detect cancer. And studies have shown that women with a large amount of dense breast tissue could be facing a 5 times greater risk of developing breast cancer.
Get it? Go get it.
Hunter knows exactly where to find his ball, but it was by chance that Corey Hansick found her breast tumor.
The tumor is actually 1.5 centimeters, and it still did not show up on the mammogram.
But it did show up in an MRI. Hansick has dense breast tissue, which can help hide tumors in the breast.
Mammograms seem to have a problem with detecting tumors in women who have dense breast tissue because it's basing its study or findings on density. So the other tests actually are not based on density, so they actually do a little bit better with detecting breast cancers in women who have this problem.
A new American study looked at whether other diagnostic tests might be better at detecting breast cancer in high-risk women or those with dense tissue.
The combination of mammography and ultrasound after 3 years was extremely effective in finding the cancers that needed to be found. We found them before they spread to lymph nodes. Adding MRI was even more effective at finding cancer, but was probably not necessary for the vast majority of the women in our study because we still were able to find cancer before it was a lump by just the combination of ultrasound and mammography in most of our patients.
The study also showed that having an MRI or ultrasound also meant a higher risk of false positive results and potentially unnecessary biopsies. Last year, Ontario announced women at high risk of breast cancer would receive an MRI in addition to a yearly mammogram.
If your mammogram comes back and it says that you have dense breasts or very dense breasts, push for an MRI. I wouldn't be here today talking to you if I hadn't have had that MRI.
Meanwhile, another study out of Norway suggests even with simple mammography, many women are overdiagnosed, where a woman might be treated with a lumpectomy or radiation or chemotherapy, and the woman may not actually have needed it. The key, of course, remains to be able to figure out which cancers are the deadly ones and need to be treated and which ones aren't and don't need that extensive
It's been so confusing for women.
It is
do it, don't do it.
That's right. And the standards are different in Canada and the U.S. In the U.S., you start a mammogram at 40. In Canada, the standard is 50.
So what do you do?
So basically, you follow the advice of your doctor and you really think about your family history. And one of the most important things that women can do is, we can't tell if we have dense breast tissue. The way that you can tell is if your doctor looks at a mammogram, and then they can start to evaluate. If you have dense breast tissue, it's probably a good idea to consider an MRI.
So that's when you hear dense, you know that's the trigger.
Yeah, and family history, of course. There are a number of different factors involved.
All right, Bea. Thank you.